For your presbyopic patients, X-Cel Contacts presents the Pro Plus Multifocal. Pro Plus is a biaspheric multifocal GP lens that's easy to fit by using the patient's corneal measurements and spectacle RX. And it's simple to evaluate the lens fit by using normal fluorescein pattern assessment techniques. The center portion of the lens, with its low eccentricity, provides clear distance vision, while the adjacent mid-peripheral area has a more rapid rate of flattening to provide near power. The well-fit Pro Plus lens should be centered on the cornea or slightly superior and tucked under the upper lid. Similar to the fitting goal of a single vision lens, the Pro Plus lens should move freely during the blink. To evaluate the lens fit, use the same fluorescein pattern evaluation technique as you would when evaluating a single vision fitting lens. Due to the back surface aspherics, the fluorescein pattern may show a slight amount of apical pooling in the center. Ideally, the center distance optic should position over the pupil in normal room illumination during primary gaze. For the patient to achieve optimal near vision, it's necessary for the lens to shift upward when looking down to read. This translation allows the pupil to access the mid-peripheral area of the lens, facilitating optimal near vision. For your new presbyopic patients, try the Pro Plus Multifocal lens first. This biaspheric GP design can prove more comfortable than many of the thicker segmented designs, and for patients currently wearing GP lenses, it's easy to make the switch to the Pro Plus lens. The Pro Plus is an excellent choice for all myopic presbyopic patients and those with hyperopic corrections up to +10 diopters. However, patients who do not require any distance correction and do not feel the need to wear their correction on a full-time basis may not be the best candidates for this lens. Yet while these patients may pose more of a challenge, a well-motivated patient can be successful. The Pro Plus Multifocal is most beneficial for presbyopes whose near add powers are between +1 and +2 diopters, and whose astigmatic correction is between 1/2 and 2 1/4 diopters of with the rule astigmatism. The Pro Plus aspheric optics provide intermediate vision, making them a great choice for patients who spend multiple hours on the computer, which includes just about everyone today. The recommended distance zone of 3.6 millimeters coincides with the pupil diameter of most patients in the early to mid stages of presbyopia. For those with larger or smaller pupils, 3.9 millimeter or 3.3 millimeter distance zones are available. For patients with a hyperopic prescription of +3 diopters or higher, a 3.3 millimeter distance zone is suggested. The Pro Plus lens is available in diameters ranging from 8.5 to 11 millimeters. The average cornea measured horizontally is between 11.5 and 11.8 millimeters, and for these patients, a 9.5 millimeter diameter lens is recommended. This diameter helps the lens to center and increases patient comfort. Choose a 9.5 millimeter diameter lens for all eyes, except those with unusually large corneas, where a diameter of 9.8 millimeters is indicated. After an analysis of hundreds of successful Pro Plus fits, we've developed a nomogram to help you choose the base curve for the initial lens. You'll notice they're fit slightly steeper than K, which aids in lens centration. The amount of corneal astigmatism is a determining factor for base curve selection. If the corneal astigmatism is between 0 and 1 diopter, select a lens a 1/4 diopter steeper than K. If there's 1.12 diopters to 1.87 diopters of corneal astigmatism, a base curve a 1/2 diopter steeper than K should be chosen. If 2 to 3 diopters of astigmatism is present, choose a base curve 3/4 of a diopter steeper than K. For amounts greater than 3 diopters, please call our experienced lens consultants for fitting advice. The Pro Plus Multifocal can easily be fit empirically. Use the patient's Ks and spectacle RX and follow the base curve selection chart using the recommended diameter and distance zone parameters. If you prefer, diagnostic lens fitting is also available. For some fitters, this reduces the fitting time and increases their rate of success. To request a diagnostic lens fitting set, please call our customer service department. Use our fitting guide to easily incorporate the Pro Plus Multifocal lens into your busy practice. That's all it takes to be on your way to achieving success for your presbyopic patients. Let's review the fitting steps. Step number 1. Always begin with the current spectacle prescription in minus cylinder form. Determine the spectacle add power. You can measure the corneal curvature with a keratometer, since topography isn't necessary in fitting the Pro Plus Multifocal. Whether choosing your first diagnostic lens or ordering lenses empirically, use the selection chart to determine the base curve based on the amount of corneal astigmatism. Next, use the recommended 9.5 mm diameter and the standard 3.6 mm distance zone. The last step in the fitting process is to determine the lens power to be ordered. First, vertex the distance power of the spectacle prescription to the corneal plane if necessary. Next, adjust for tear layer effects depending on the base curve selected. When fitting steeper than K, compensate for the tear layer effect with minus power. And finally, determine the near power by adding a half diopter of plus to the patient's spectacle add power. This is to ensure the best possible near vision. Before evaluating the patient's vision, allow the lens to settle for 10 to 20 minutes or as long as possible. Test the patient's vision binocularly. As with eyeglasses, monocular vision testing will not provide an accurate assessment of functional vision. The distance acuity with the Pro Plus Multifocal is expected to be equivalent to that obtained with single vision contact lenses. Always perform the overrefraction using handheld trial lenses instead of the 4-opter. Testing in this manner is more indicative of how a patient sees through their bifocal contact lenses and allows reading objects to be held in their natural position. Let's review these fitting steps with an example. The patient's spectacle prescription is minus 3.75, minus 0.75, axis 180, with a reading add of plus 1.5 diopters. The K readings are 41.75 at 180 by 42.50 at 90. Note that the difference between the flat and steep corneal meridian is 3/4 of a diopter. Under these circumstances, the fitting nomogram suggests that we start with a lens a 1/4 diopter steeper than K. Given this information, if the patient's corneal diameter and pupil size are normal, we would order the following lens parameters: a 9.5 mm lens diameter with a 42 diopter base curve and a 3.6 mm central distance zone. In this case, we'll adjust the distance power to minus 4 diopters, since the lens is being fit a 1/4 diopter steeper than K. And we'll order an add power of plus 2 diopters, factoring in the recommendation to add plus half diopter to the spectacle prescription add. While our Pro Plus fitting system eliminates most of the potential fitting problems up front, in some cases it's still necessary to troubleshoot. To help you, we've developed a problem-solving section with our fitting guide. The problem-solving section makes recommendations for situations such as excessive lens movement, non-translating lenses, and poor distance or near vision. When observing excessive lens movement, consider a steeper base curve. If the lens is not positioning properly and a change in base curve doesn't improve centration, increase the diameter. Keep in mind that base curve changes should be at least a half diopter to be effective, and diameter changes should be at least 0.3 millimeters to see a result. If the patient is experiencing poor near acuity, even though distance vision is good, check the translation of the lens first. Make sure the patient is holding his head up while looking down to read. If he's tipping his entire head down toward his reading material, the peripheral lens area won't position properly over the pupil, and good near vision is difficult to achieve. If the patient has difficulty with near vision while distance is good and the lens centration and translation are adequate, consider decreasing the size of the distance zone from 3.6 millimeters to 3.3 millimeters. If the lens doesn't translate when the patient looks down to read, as mentioned in the previous slide, check to ensure the patient is holding his head up when looking down to read. If the lens doesn't translate or easily move up and down with a blink, a flatter base curve may be indicated. Now let's talk about good near acuity with poor distance acuity. First, check to make sure the lens is well centered so the distance zone positions over the pupil area. A lens that rides up too high or low can blur distance vision. If this is the case, choose a different base curve or increase the diameter. Next, check the overrefraction to ensure that the calculations were correct. It's recommended to always prescribe the minimum amount of minus power or most plus power. If these don't work, next consider increasing the distance zone size to 3.9 millimeters. The ProPlus Multifocal lens has a base curve range to accommodate most corneal shapes. Nearly every distance power is available, with add powers up to plus 2.5 diopters in quarter diopter steps. While we recommend starting with a 9.5 millimeter diameter, a variety of diameters can be ordered. The distance zone options are 3.3 millimeters, 3.6 millimeters, and 3.9 millimeters, with 3.6 being the standard choice in most cases. And we suggest using Boston XO, Boston EO, or Boston ES for the best performance in fitting the ProPlus multifocal lens design. The ProPlus lenses are packaged in a unique X-Cel convenient screw-top lens case and shipped in a preserved aqueous solution. Receiving the lenses in a hydrated state ensures cleaner, wetter lens surfaces, increased initial patient comfort, and overall satisfaction. It's recommended to clean the lenses before dispensing them to the patient. The ProPlus lens design has a 90-day guaranteed fit, and there's a 100% credit on 2 exchanges per eye and cancellation. Still not sure what to do? Call or email our experienced fitting consultants. We're eager to help you be successful with the ProPlus multifocal lens. Call any of our locations to receive more information. Try a pair of ProPlus multifocal lenses today. Brought to you by X-Cel Contacts, innovators in GP lens design and manufacturing.